We're live now. Good afternoon, everyone, and welcome to the second webcast of our initiative, Distress in Diarrhea. This session is being organized by Voice of Healthcare and is supported by United Nations Global Compact Network India and Dr. Reddy's laboratories in the issue of public health. The session aims to empower individuals with accurate information on the causes, symptoms, and preventive measures of diarrhea, and also on the role played by government, non-profit organizations, and the pharmaceutical industry. The focus is to promote proper hygiene practices, safe water consumption, and right treatment at the right time. The campaign seeks to reduce the impact of adult diarrhea and contribute to the well-being of communities across India. I'm Dr. Anushka Amlani, and on behalf of Voice of Healthcare, I'm humbled to moderate this panel discussion on holistic approaches to addressing diarrhea challenges, integrating health, industry, and policy perspectives. We are grateful to our esteemed panelists for joining us today. Ms. Dr. Govind K. Makharia, President, Indian Society of Gastroenterology, Professor, Department of Gastroenterology and Human Nutrition, AIIMS, New Delhi. Welcome, sir.
Thank you.
Dr. Somnath Singh, Deputy Director, United Nations Global Compact Network, India. Welcome, sir. Dr. K. Madan Gopal, Advisor, Public Health Administration, NHSRC, Ministry of Health, Family Welfare, Government of India. Welcome, sir. Dr. Basvaraj Dhabari, Deputy Director, Child Health, Ministry of Health and Family Welfare, Government of Karnataka. Welcome, sir. And Mr. Manish Bajaj, Cluster Head, DRL. Thank you for joining us today. Moving on, I request Dr. Govind Makharia to kindly set the stage for our panel discussion today. Sir, can you please provide an overview of diarrhea, including its manifestations in adults, and discuss about the clinical challenges associated with diagnosing and treating diarrheal diseases?
Thank you, Dr. Anushka, and thank you so very much for your kind invitation. I think this is a wonderful initiative talking about certain clinical issues and looking at a multidimensional approach. So your question is in diarrhea. So now we have a diarrhea means what? There's increase in frequency of stool or increase in quantity of stool. Either is in terms of frequency, more number of stool per day, or there's a more liquid in the stool. So both constitute diarrhea. So diarrhea of two kinds. One is acute, means acute diarrhea which lasts for less than 2 weeks, and a chronic diarrhea which can last for longer than 4 weeks. So two different clinical scenarios. Now coming to why does diarrhea happen? Uh, there are two main reasons. One, that whatever we eat is not digested properly because of certain disorder of small intestine, and therefore the food is not absorbed, passes in the stool in a high volume. That's called diarrhea. And second, more important, is because of any infection, if of GI tract like enteritis or so-called gastroenteritis, which can lead to more secretion of water and electrolytes in the small intestine, and that's not absorbed by the large intestine, and that leads to diarrhea. So there are two clinical scenarios uh, which are important. So acute diarrhea, which lasts less than 2 weeks, chronic, which lasts 4 weeks, and both of them are different disorders. Acute most time will resolve. Chronic may persist unless we treat the disorder. So, as I said, coming first to the chronic disease, like in the chronic disease, uh, where disease of the intestine is there, then most of them are functional. 80% of all chronic diarrhea, which lasts more than 4 weeks, are functional in nature. Means there is no demonstrable disease inside the intestine, but because of increased motility or in because of very minor histological issue or minor illness in the large or small intestinal mucosa can lead to diarrhea. And second, which is more important, is if there's a disease of small intestine mucosa, for example, celiac disease or say tropical disease, that can lead to damage of the small intestine, and that leads to non-absorption of food which we eat and can lead to diarrhea. So that's how we differentiate this type of diarrhea. So one more point to highlight that acute diarrhea is something which is very important to recognize. Acute diarrhea can lead to, if it's severe in nature, can lead to dehydration and can lead to life-threatening situation, especially in children. If the diarrhea occurs in acute diarrhea occurs in children, there's a high risk of mortality. I think we can discuss this point later in the discussion, but we must know that children are at higher risk of mortality if they develop acute diarrhea, whereas adults can sustain the water loss and the mortality rates are lower in them.
Thank you so much, sir, for your elaborate explanation about diarrhea. Based upon the clinical differentiation of diarrhea, my next question to you is that India is a very diverse country and our population is very diverse. And having said that, the healthcare needs are very different for different populations. So, in given in our landscape, do we have any tailored programs or management strategies for in specific to acute diarrhea or chronic diarrhea? And if we, what is the current status of these strategies? Are they there? And if they're not there, what is the scope of accommodating the regional variations to ensure that we have effective outcomes for patient care?
Again, as you right, I think it's a very important point. Uh, first look at acute diarrhea. As I said, acute diarrhea in children, which occurs because of infection, and most important being viral infections, adenovirus, rotavirus, certain bacterial infections like Campylobacter, Shigella, E. coli. So these infections are very common in our population. And these infection can, in children, if immune system is not able to control the infective organism, that can lead to secretion of water in the small intestine, and that leads to diarrhea. So, as I said in my previous discussion, that acute diarrhea in children is something which is very relevant, and for which we have earlier we had national program for acute diarrhea in 1970s and 80s, but now later this program has been merged with RCH, reproductive and child health combined together, and since mortality in children is high, so this is a high priority area for government. I think in all the states this is a high priority area. Through National Health Mission, uh, this care is provided. Any child with diarrhea, care is provided. And why it is so? If you look at mortality in these patients, is so important. And I want to highlight 2 points out here. Number one, if you look at the ultimate outcome of acute diarrhea is that mortality, how many people die. So if you look at all age group, and this is data from global survey, that in all age group, about 32% of, of 100,000 people, 32 per lakh people may die of acute diarrhea overall. But in less than 5 children, if the children less than 5 years, is about 47. So it's higher. Number two, that from 5 to say 50 years, the rate of mortality is not very high. It's about 5 to 8, very low per 100,000. But as you go in higher ages, more than 60 years, mortality is almost 6 times higher. Almost about 500 elderly person will die if you have acute diarrhea because of any cause. So elderly persons acute diarrhea is very, very relevant for us and for society. And because they have less capability to handle dehydration. Dehydration leads to renal failure in them because there's already chronic kidney disease, many of them, and they also have a high risk of cardiovascular risk. So dehydration in an elderly person is very important. And I must say that in any family, any elderly person more than 60 years of age, if they have diarrhea, we must take care appropriately. So two situations, if people are more than 60 years of age and people less 5 years of age, means children 5 years of age, less than 5 years age, they are the most vulnerable people for complication of acute diarrhea. The adults are fine. Uh, if they have diarrhea, giving them rehydration solutions on approach, that takes care of everything. Uh, One more point I want to highlight here that the mortality rate of diarrhea has decreased over time from 70s now to 2020. People dying both in children and adults, the death rate has decreased markedly, and all because of more education, better water, better sanitation. We are not the high of better water and water security. We still have to improve those approaches, but nevertheless, the mortality rate have decreased. So this is about acute diarrhea, the variation. For chronic diarrhea, I would believe that about 10% of our population, about 10%, will have some kind of chronic diarrheal illness. And the most important of them is a functional diarrhea, which is called functional GI disorder, functional gastrointestinal disorder. And among them, there are two kinds. One is called irritable bowel syndrome, diarrhea type, or there is a functional diarrhea. So, 100 people in our community, 10 will have such disorder. So this functional diarrhea is not a major problem. It is the symptoms, but not a major problem. But there are certain disorders, for example, celiac disease, where the food is not absorbed because of atrophy of mucosa, that leads to malabsorption. Food is not absorbed, and therefore there is anemia, there is a short stature, there are many other manifestations because of that. The other group is, I can say, is a IBD. It's called inflammatory bowel disease, where there are ulceration in GI tract, and that can lead to that. So overall, we have a acute chronic, we have a mucosal disease where food is not absorbed, and we have a inflammatory disorder where there are ulceration in the GI tract, and that can lead to diarrhea.
Thank you so much, sir, for giving us the statistics and also highlighting the vulnerable groups that in whom diarrhea is manifested. And since you've reflected on that, my next question is to Dr. Madan Gopal. So, what are the strategies that are being implemented at the national level to ensure that effective dissemination and implementation of government initiatives that are aimed at diarrhea awareness? Given the fact we are already aware, we already have a number that the vulnerable groups are under the age of 5 and 60 plus, and also so because we have made so many improvements from 70s to 2000s. So, what is the current status of strategies that are being implemented?
Thank you, Anushka. Thanks, Voice of Healthcare, for uh, getting me as an panelist for this session. One of the important things which we should understand is why diarrhea is more important. Because we, from the government perspective, we have only bothered about the outcomes of the initiatives, other things which we are doing. One of the important things, if you look at the way things have progressed, if you look at the infant mortality rate, the crude death rate, you see that among the diarrheas, cholera used to be one of the biggest epidemic disease. Now, more or less, it is sporadic occurrences are being reported. But still, the major chunk of the infant mortality rate, if you analyze that thing, diarrhea and pneumonia used to be one of the major killers in throughout. That means in the perinatal, in the neonatal, as well as the post-neonatal period. In the under 5 age group also it is there. But as mentioned by my previous speaker, the diarrheal deaths, in India, around 1.5 lakh deaths annually are estimated due to diarrhea. It's estimated, not reported. These are all estimated. These are estimated from various sources. This happens because of this diarrhea. The second thing is diarrhea as you have mentioned, the diarrhea in a older age group is very serious because the water composition in the body is very less. in the children, the water composition is also very high. So even a small variation or small a single big episode of diarrhea can result in lot of changes in the cellular mechanism. That's another thing that is beyond the course of this discussion. Understanding the gravity and the magnitude of this problem, the government of India has been doing many programs for the last many years. Initially, it was the Child Survival and Safe Motherhood program, in which the focus was on reducing the mortality due to diarrheal diseases. Then this program was subsequently changed into mother and child health care, then rolled out as a reproductive child health, and now it has been rolled. Now after the NRHM, now it's a part of the National Health Mission. So government is having a clear cut. It provides the central government provides the resources, the funds, guidelines, how the diarrhea is to be managed, right up to the uh, Arogya Mandir level. I think need not to say about the structure which has evolved over the many years. The government is having a beautiful structure. Our frontline food workers are the ASHA workers who are in every village. Then to at a population of 5,000, you are having a community health officer who is manning the Ayushman Arogya Mandir. And at a 20,000, 30,000 population, you are having a medical officer. And above that, the community health center, the sub-district hospital, and the district hospital. This kind of system is there. And this system is all augmented, and the specialist services are also made available through the telemedicines which are there. So that means through and through the mechanism system is there. The government is implementing all the mechanisms of the system. The RCH program which I have mentioned is part of the NHM program. It talks about child survival. I think lot of activities are happening, and one of the important activities which is done on an annual basis is the fortnight observation of fortnights and preparation for the diarrheal disease, because the epidemiology has shown that during the months of monsoon, so diarrheal episodes or the incidence of diarrhea increases. If you talk about the episodes, uh, most of the around 25% children, they have one or two episodes of diarrhea as based on the 15 days recall period. But we are not, I'm not going to that. But what we do before the onset of the monsoon, a 15 days preparedness fortnight is observed, in which we ensure that the ORS and the zinc tablets they are made available, because it has been proven that ORS and the zinc combination they will reduce the mortality and the subsequent morbidity associated with this year diarrhea things. Besides that, one of the reasons which were identifying the rotavirus, because in winter you have the rotavirus diarrheal episodes. For that also we are having a rotavirus immunization. This is part of the national immunization now, and it has been rolled out across the country. Previously it was in 18 states. Now it has been rolled out across the country. That means fortnightly, and this ORS is made available round the year. But during the fortnight, this June, I think in June they will be celebrated. Usually it is observed during this time. It is observed that all the ORS stores which are there in every villages, they are replenished, and the orientation of the workers is also done. Review meetings happen, so the preparedness for any eventuality due to diarrheal season is been taken care. Besides that, we do have a mechanism of reporting diarrhea. The integrated disease surveillance program is there. The where you have the symptomatic reporting, the preserve this uh, presumptive reporting as well the laboratory confirmed reporting. So that mechanism is also there. Even as a worker, if she identifies any person following that symptoms, she that is immediately is fed into the system. And in case of if some clustering of cases are happening, immediately a team, rapid response team is there. The rapid response team will go and they will try to see that how the infection is there, what is the source of that infection, and the containment and other measures have been taken. This is the existing system which is there. But the other, apart from this, the national system which we are having, we do have other programs also which are the supplementing the other aspects, because social determinants for this diarrhea also plays an important role. If you see what the government is doing, you see the we are trying to make all the villages open defecation free. ODF free villages are there. The major focus is there on sanitation aspect. You have seen how the hand washing campaign which is there. in the schools, all the school hand washing campaign is happening. This is all for prevention of diarrhea. The other thing is which is happening to address the social difficulty, is trying to see that how the sanitation, because if you look at the urban areas also, the smart cities and the in the rural areas, you see that how the concretization and the other measures which are taken beyond health, they have been taken to at least improve the living conditions as well as reduce the social determinants which are causing the diarrhea. The other aspect is the other program which is there is the integrated child development scheme, which focuses on the nutritional aspect of the child. And these institutions are also equipped with your ORS and zinc tablets, and the medical and other diagnostic services are there. Beside that, if a person is not responding to the ORS and zinc therapy, the peripheral most this community health officer, he can connect with the hub at the medical college or the district hospital and seek expert guidance whether admission is required or not. That kind of mechanism also there to teleconsultation. It's all established, it's all working. It's not that it's only on paper. No, it's all working. As a result, you have seen that the number of deaths due to diarrhea, which used to be very high, now it has come down from 1.5 lakhs. It is estimated that it is around 50 to 75,000. That kind of uh, intervention is now paving way for that. Besides that, in the schools also, we are trying to train and create awareness regarding the sanitation. You see, what is the impetus of the even the small children? They are trying to importance of hand washing is being emphasized on them. Okay, these are all the initiatives which are there. Besides that, the senior care, the guidelines have been released by Ministry of Social Justice. There also emphasis on hygiene and the safer practices for sanitation is also been emphasized. So that the causative, the determinants for the cause of the diarrhea is also been taken. Besides the treatment aspects, the cause of the diarrhea. The other aspect, other department which are also working is the food safety and Food Safety and Standards Authority of India, which is the FSAI, which is now ensuring that even the street vendors, though the accreditation and other things is taking time, but they are moving in that direction to see that the hygiene and the safe practices are also there if you are buying food from outside. That's why overall you see how the in a comprehensive way we are making an effort. We are seeking the help of other organizations also to support in our initiatives. It's not that this is a plan which we are having, and most of the organizations which are there, they also come and contribute to the effectiveness of this services and the activities we are planning.
Thank you so much, sir, for elaborately explaining the current initiatives by the Government of India at a national level. I am definitely curious about the estimation part and also how we are actively and passively approaching the issue, but we do not have a National Diarrhea Day. I'll definitely come back to you with that. But having understood the national perspective, now it's time to look at the state level policies. And my next question is to Dr. Bavsaraj regarding the same. So, how crucial do you think is the integration of diarrhea management program into the existing policies? Having already heard Dr. Madan Gopal speak, what is your input regarding the same? So, kindly unmute yourself. Yes, sir, you're audible now.
Thank you, Dr. Anushka, for having me here on today. See, one thing is all of us should know right from the day of a birth, the gut is exposed to the new environment till up to the last breath. So everybody is prone for this kind of a disease all throughout the life. Of course, the effect is more on the lesser age group and the higher age group. But however, everybody will get affected with in the lifetime, some other time with the diarrheal diseases. So this being the reason, and every day, every time, everybody is getting exposed to the infective agents. So there has to be some a strategic method and a programmatic level. We have to have some mechanism to prevent development of a disease. So diarrhea, I will not get into the numbers, but what we should know is the deaths are the concern here. Morbidity part, though it is important, but the deaths are deaths were very high in 90s. The diarrhea was the second most reason for the infant deaths in 90s. Then after a decade, it became the third most common cause, and after the decade, it became the fourth major cause. And in 2015, it was a fifth major cause, and now it is a sixth major cause of the deaths. Now, of course, we are having a control on the deaths also, but the target is to have zero deaths due to childhood diarrheas. So that being the thing, only health department, or for that matter, the health professionals cannot just prevent the occurrence of the diarrhea. Health has a role only when the diarrhea occurs and when there is a need of a treatment, or otherwise prevention has a major role here. So that being the reason, every department has to contribute in preventing the diseases, be it rural development, urban development, or sanitation department, sanitary and water hygiene department, or more importantly, the educational department, where they inculcate good habits in the children in its early life stage. So everybody has important. That is the reason it's a multifactorial approach is more important. So every policy in that matter should incorporate this. So that is the reason, as soon as a child starts taking the feed, what I mean is not the complementary feeding. The very in the early initiation, that is in the less before 1 hour itself, every child should take the mother feed. So the breastfeeding is a very important component that actually gives immunity to the children. From there, we have to start acting. Subsequently, the exclusive breastfeeding for the first 6 months, the child has to be only on the mother's milk, uh, except when the doctor advises some other medications. Or otherwise, the child should not be fed even with the uh, water also, purified water also. Then subsequently, in the complementary feeding, we should take care of so many things. And when the child starts growing up, maybe in the age of between 2 to 3, the child is more prone for development of these diarrheal diseases. So we have to have a comprehensive healthcare that is easily accessible to the public. And on the other side, we have to have the primary healthcare well equipped to handle the cases. Now, more importantly, here, the community should be empowered to treat diarrhea at the home. Uh, Pre-referral treatment is also important. So we have to have community participation in order to prevent the deaths in the diarrhea. So a comprehensive healthcare system will definitely help in this. But more importantly, uh, because these diarrheas happen in the cluster and more in the low socioeconomic groups, so we have to have a tracking mechanism, as Dr. Madan Gopal was saying. The integrated management of a disease control system will identify the clusters of the diseases, but however, the other departments also should be reporting about the diarrheas, and they should be reporting about the measures that they have taken up to curtail the diarrheas. So, in short, to have a long-term sustainable mechanism, every department in its policies to address the prevention of a diarrhea, they have to have some mechanism, some programs at all levels, right from the age group of the newborn till up to the elderly age group. So integrating diarrhea management programs in all the existing policies is very much important in that context.
Thank you so much, sir, for your comprehensive to making us understand about the current status and the comprehensive policies that can be integrated for an effective approach to address diarrhea. Having discussed the policy part and the clinical part, our next goal is to understand how the pharmaceutical companies play a key role in research and development. Having said that, my next question is to Mr. Manish, sir. So, how do pharmaceutical companies actively contribute to research and development and widespread distribution of treatments for diarrhea in specific? Are there initiatives that have been taken beyond medication?
Thank you, Dr. Anushka. Yes, I think pharmaceutical companies, we play a big part, especially in the research and development of newer molecules, newer formulations, medicines that have better efficacy, more safety, better tolerability, better convenience for the patients. And I would say, as Dr. Govind Makharia pointed out, I think for the acute diarrhea, the effort is to make sure, I think, we are having medicines which can affect a lot more of the patients with better efficacy and lesser side effects. So that's one of the goals from R&D standpoint. And can we combine different therapies, antidiarrheals with probiotics, to chronic diarrhea, where I think the intent is for IBS or IBD patients, as Dr. Makharia pointed out. Can we have probiotics that can be personalized for their particular gut microbiome? And in those disease conditions, which is chronic diarrhea, there is also a role of biologics that is coming to fore. And as pharmaceutical companies, Dr. Reddy's, and even many of our counterparts in the pharmaceutical industry are working on R&D on this particular front. The second piece is also the breadth of the portfolio, as I think the speakers before me pointed out. The multiple medical paradigms of treating diarrhea, right from antibiotics to probiotics to antidiarrheals, and thus having a wider portfolio is also important. And like for Dr. Reddy's, we have antidiarrheals like Redutil, to probiotics like Econom and Protectis, to antibiotics like Sebofix, and even the ORS under our Rebalance franchise. So having this entire range of products available for patients across the age groups is very critical from a pharmaceutical company standpoint. The third piece is accessibility. We can make these products through our R&D and manufacturing, but we have to make sure they're reaching the nook and corner of the country. India is a very heterogeneous country, and as I think Dr. Madan Gopal pointed out, a lot of this incidence is right in the rural areas. For Dr. Reddy's, I think for our diarrhea treatments, we are reaching close to 2 lakh odd doctors, I think, making them aware of our medicines, and even getting to 2 lakh retailers and making our products sort of available at those retail outlets for patients to benefit from. So that's on the accessibility standpoint. Now, I think on beyond the pill, I think what can pharma companies do beyond the pill in terms of helping diarrhea management and prevention? So there are a couple of areas. One is increasing the patient awareness, improving the awareness of patients on diarrhea management and even prevention. The second is around diagnosis. How do we get better diagnosis of the disease upfront? And the third is around adherence and compliance to the therapy. So that's critical. One of the simple efforts that we have started, I think, in the olden times, radio was the place where people went for information. And nowadays, people go to YouTube or podcasts, right? So I think we have tied up with, I think, 500 odd doctors, and I think with a special program called Inside the Indian Gut. And through this, we have reached out to lakhs of patients on, I think, the do's and don'ts of diarrhea management, and even prevention on basic hygiene, as Dr. Madan Gopal pointed out. How do we inculcate some of these basic hygiene practices in the general population? Lastly, on the bit of innovation, I think one frontier for diarrhea management, especially for the chronic diarrhea, is around digital health. I think we have the pills that we are working on. We are working on areas beyond the pill, and now digital health is one area. That's an area that the entire industry needs to look at, especially from a chronic diarrhea standpoint. And given the disease is the chronic diarrhea disease, which has a etiology of IBS, irritable bowel syndrome, or inflammatory bowel disease, or celiac disease, as Dr. Makharia pointed out, needs a integrated and a multidisciplinary management of that disease. And I'm happy to share that I think Dr. Reddy's has launched one of its kind, I think, a multidisciplinary and integrated program for management of diarrhea in IBS patients, and a program called Daily Blue, which includes, I think, consultation with the doctors, along with management of the diet, along with, I think, support on their mental health, because some of these diseases also have a gut-brain axis, the linkage to the psychological issue. So providing a holistic care to the patients in these diseases is also critical. So that's, I think, I feel the next frontier in terms of managing the chronic diarrhea patients. And I think Daily Bloom is one such effort from Dr. Reddy's, and I'm sure many of my counterparts in other pharma companies are also working in similar directions.
Thank you so much, sir, for shedding light on the contemporary approaches of your team and also paving the path for future execution plans. Thank you so much. My next question is to Dr. Somnath. So, given your extensive experience in the leading health initiatives and projects, how do you see the intersection between health and sustainability? And what role do you believe businesses should play in addressing challenges like diarrhea? So, kindly unmute yourself. So, you're not audible. Kindly unmute yourself.
Thank you, Dr. Anushka, for your brief introduction. And my heartfelt thanks to the Voice of Healthcare for its continued collaboration with you and Global Compact Network India for its second edition of addressing diarrhea challenges that are being organized now towards strengthening value-based healthcare in India. Dr. Anushka, as you asked me very relevant question related to healthcare. So being an local network of United Nations Global Compact and the custodian of implementing sustainable development goals, I would like to mention here that SDG which talks about good well-being has become an important area of work for us, and therefore we are running various projects and initiatives to strengthen responsible business practices in the healthcare sector with support and guidance from United Nations Global Compact headquarters, government and private sectors. So here to begin with, I would like to share my thoughts on the theme addressing diarrhea challenges through integrating health, industry and policy perspective. So, in my view, addressing diarrhea challenges requires a comprehensive approach that integrates perspective from health, industry, and policy realm. By fostering collaboration among these sectors, we can develop holistic solutions to combat this widespread issue. From a healthcare standpoint, it's essential to prioritize preventive measures such as clean water access, as my co-panelist has already discussed about it, and proper sanitation and vaccination programs. And Dr. K. Madan Gopal has talked about the initiatives taken by the government of India, and additionally leveraging advancement in healthcare technology as Mr. Manish was talking about it. So healthcare technology can enhance diagnosis and treatment methods. Industry involvement can play a crucial role in ensuring the availability and affordability of essential, medication and hygiene products. Moreover, promoting responsible marketing practices can help, mitigate the spread of misinformation. On the policy front, implementing regulation to improve sanitation standards and investing in healthcare infrastructure are paramount. So furthermore, advocating for policies that address social determinants of health, such as poverty and education, can contribute to long-term diarrhea prevention efforts. By standardizing perspective, we can create a robust framework for tackling diarrhea challenges and improving global health outcomes. So now I come to the point of how BU and Global Compact Network India, I see the intersection between health and sustainability, and what role do I believe business can play in addressing health challenges like adult diarrhea while advancing their sustainable agenda. So, based on my long experience in leading and managing healthcare initiatives nationally and globally, I would like to share my views and learning about the intersections between health and sustainability. So, first point is, according to me, is human influence on the environment continues to grow. Many of them resulting risk are continuously generating disease and injuries, impacting quality of life, reducing productivity, and weighing on the health systems. And the second point is the reduction of environmental pollution and advancement in hygiene have contributed significantly to increase in human health and life expectancies over the last 150 years. So particularly in high income countries, but even today, contaminated water, food, and air remain major cause of suffering and death globally. Many of these problems are expected to be a major cause of to be worse by ongoing climate change. Healthcare system need to adapt significantly to a future in which gradual warming and extreme weather events will increase the risk of human health. And the third point that ensure the intersection between health and sustainability is climate change. which is very much linked to several health-related risks, including injuries caused by storms or flooding, the spreading of insect-borne infectious disease, and the chronic respiratory infection, cardiovascular infection, and kidney disease. In addition, extreme weather events, global warming, and changes in humidity indirectly, affect human health by disrupting healthcare delivery and endangering food security. Even in high-income countries, the negative health effects of climate change will be more severe for disadvantaged populations, and this impact is expected to deepen existing gaps in health equity. And there is an opportunity for more countries to develop national climate adaptation plans with health focus, and for both the public and private sector to invest more in health related adaptation financing. So the challenges related to adaptation will be even greater for low and middle income countries, which are already facing and largest health burden today. Their current response is often impaired by long, robust healthcare systems, and they have limited resources to build long-term resilience. The next point is, according to my view, is understanding the intersection of climate change mitigation and human health is important for effective action in both areas. Healthcare systems are major emitters of carbon dioxide and other environmental pollutants. Mitigation of further environmental and climate change will thus have to involve efforts to reduce the footprint of healthcare providers and healthcare industries around the world. At the same time, there is significant potential for synergy between the advancement of human health and climate change mitigations. The concept of a planetary health guide illustrates this as it captures both promoting individual health via better nutrition and reduce environmental pollution from a transformational of food production. So, in conclusion, sustainable living and human health are intricately linked by acknowledging the environmental factors that impact our well-being and adopting sustainable practicing in our daily life. We can, form a healthier planet while educating residents, people about health and well-being. And considering what role the business should play or can play in addressing health challenges like adult diarrhea while advancing their sustainable agendas. So, in my view, working closely with the private sector, public sector, I think the businesses can play a significant role in addressing health challenges. So, while advancing their sustainable agenda through various means. First, product innovation. So companies can invest in research and developments to create products that promote digestive health, prevent diarrhea. This could, include probiotic, prebiotic, and functional foods that support gut health. And also they can support in education and awareness kind of initiatives. So businesses can engage in public education campaigns to raise awareness about the causes of adult diarrhea, proper hygiene practices, and the importance of medical care. This can help prevent diarrheal disease and reduce their burden on healthcare system. Similarly, they can also help for the people to increase their access to clean water and sanitation. And for businesses, they can also ensure balance between the business and sustainability in their supply chains. And also they can increase the healthcare access to the people. And one important things that I would like to highlight here, that businesses can provide their employee health and well-being facilities. They can prioritize employee health and well-being through workplace well-being program, access to healthcare services and sanitation facilities, which can help reduce the risk of diarrheal disease among employees and their families. And from the global compact point of view, the businesses can strengthen collaboration and partnership with different stakeholders, healthcare stakeholders. So they can also collaborate with government, non-profit organization, and other stakeholders to develop and implement comprehensive strategy for addressing health challenges like adult areas. So by pooling resources resources and expertise, they can achieve greater impact and sustainability. And one important thing is, advocacy for policy change. As Dr. Madan Gopal was discussing lots about policies, and therefore business can also play a very important role in advocacy for policy change. So I think businesses can work closely with the government, and they can do some relevant research. They can come with the their recommendations in the area. They can do advocacy with the government and bring the policy that can benefit a huge number of people, or the beneficiaries in the country. So that's why I can say that there is a robust evidence that businesses have a strong value proposition for investing in health. While companies begin to address health equity, there is also growing realization that investors, job seekers, and customers are increasingly willing to make decisions based on corporate social responsibility. So, in my view, by integrating these health consideration into their sustainable agenda and collaboration with other stakeholders, businesses can make meaningful contribution to addressing health challenges like adult diarrhea while advancing their long-term sustainability goals. Thank you, Dr. Anuska.
Thank you, Dr. Somnath. Moving forward to our second round of discussions, my question is to Dr. Govind Makharia. So, in your review, what are the critical components for standardizing the treatment approach for chronic adult diarrhea? Do we have any guidelines for the management in specific to India? And if we don't, can you please share your insights regarding the same? So kindly unmute yourself.
I'm sorry about that. So I think this is very, very important issue. We believe in one term, what is called quality of care. Quality of care means that every patient around the country or region gets similar kind of treatment. Treatment being instituted by a primary care physician or secondary care physician or tertiary care physician. And therefore, we require standardized guidelines, because everybody may not be an expert on treating all the diseases. But if you have a guideline, practice guidelines, which are evidence-based and advise you how do you tackle a patient coming to you with chronic diarrhea, for example. So chronic diarrhea is caused by numerous causes, maybe at least 100 etiology. So you cannot test for 100 at one time. They're too expensive and they're too invasive. So therefore, you apply certain principle and pattern of disease, and based upon that, you decide that this disease is likely to be disease A or disease B. And similar to that, you plan investigation depending upon your priority, and then you investigate, treat. So there's a need to develop a guideline on diarrheal disorders, both for acute and chronic, because they're two different things. For chronic disease first, till now there are no guidelines. Most people write that are close to a patient with chronic diarrhea, but they are very expensive and they're not easy to understand because they're very complex. So we have decided from perspective of World Gastroenterology Organization, and maybe I talk a word about that. The WHO, the World Gastroenterology Organization, makes a global guideline for management of chronic diarrhea, how to diagnose. And they are cascade guidelines. Cascade means that even you are a nation with limited resources, how do you assess the patient compared to those countries where resources are not equal to it. So we have cascade guidelines, and now we are on to it. So they will be in few months' time. We will have global guidelines on diagnosis and management of chronic. And I will be chairing this guidance committee. We already have involved experts from world over, and we are going to start the process. This is a global view. Similarly, we will have to adapt these guidelines to Indian context, because the Indian context, the diseases are different. For example, if you go global, the celiac disease is a common cause of chronic diarrhea. This is the cause of chronic gastritis. It's also the channel. But in India, infective cause will also come as important. For example, tropical storm or ulcerative infection. So the global guidelines is we discuss with India also have a different tweak, and we are going to work on that. These are the chronic diarrhea guidelines. Coming to acute diarrhea, I think acute diarrhea is very, very clear cut. If anybody has acute diarrhea, it is a bloody diarrhea approach which is in the large industry. Those patients require antibiotics, and they are well in guidelines. And those patients have a very watery diarrhea, they're mostly viral, some bacterial. And in that situation, the most important is to rehydrate the person, either by oral, using oral therapy, or by intravenous in certain patients who have a marked dehydration. So, and second would be that when to use antibiotic. And again, we know that acute diarrhea, which are most of them are viral in nature, but by practice, many of us are already ourselves accustomed to take antibiotics, and many of the physicians will take antibiotics, for which is not required for every patient who has a diarrhea, antibiotics are not required for everybody. But there are certain indications which are well defined, all textbook writes about it, that when to use antibiotic in patients with acute diarrhea. I saw it about probiotics.
Thank you so much, sir, for highlighting the importance of standardizing the guidelines and also mentioning the challenges in the Indian context. Moving forward, I would like to ask my next question to Mr. Manish. Sir, how can the pharmaceutical industries work hand in hand with government agencies and non-profit organizations, medical associations, to support the initiatives that are aimed at making diarrhea a health priority for all? And what role can corporate social responsibility play in this endeavor?
Thanks, Anushka. Yeah, as a company, Dr. Reddy's, I think, takes its CSR and ESG goals very seriously. And we like to work on the triple bottom line, as Dr. Somnath mentioned. I think profit, people, and planet, all three become very important for us. And one of our ESG goals is to reach 1.5 billion patients by 2030. And it's important in that sense. I think we have our products available to as many patients across as many countries around the world. And one such initiative that we have also around our CSR efforts is on safe drinking water. I think Dr. Madan Gopal pointed around that the importance of safe drinking water to reduce the incidence of diarrhea. It has come down dramatically, but we are still not among the developed countries as we would like to be. One such initiative that we have funded through our CSR activity is called the Nandi Community Water Services. And through this effort, we have reached out to the bottom of the pyramid, around 9 lakh odd people in 7 states, in providing them a sustainable manner to safe drinking water. And I'm sure it's very, very critical to provide safe drinking water so that we can reduce the incidence of diarrhea and especially the incidence of death in children. The other piece, I think, from a awareness standpoint, is how do we get to the patients a lot more sooner in a deeper manner. And one such initiative that we've taken is called the Swasthya Shala. Is, I think, a simple activity of washing your hands before having a meal is so important. And so with the pediatrician fraternity, we have reached out to 150 odd schools, and I think made this message clear to lakhs of kids and children the importance of washing your hands. And I'm sure it's a small drop in the overall efforts that we need to drive in the prevention of diarrhea and awareness of patient, but still an important effort, and we take it very seriously. The other effort that we are doing is providing these diarrhea patient kits, which includes the most important ORS, a probiotic sachet, and a patient education leaflet. And we have distributed this to around like 5 lakh odd patients. And through this effort, we want to make sure, I think, the right treatment is available even to the needy patients. And that's where I think at the bottom of the pyramid, where still the hygiene issues are still prevalent and still need to be solved. Another piece I think Dr. Makharia talked about, I think the WGO and the guidelines for chronic diarrhea. We have done our small part with the Indian Medical Association, which is the association of 3.5 lakh doctors across 29 states in the country. And through this association, we have formulated the the guidelines for management of acute diarrhea in adults. And I think this is combining the evidence from within the country, outside the country, the best of the scientific evidence available, and we have compiled it into a booklet for management of diarrhea. And it's important we have the latest science available to the doctors. And now that the guidelines have been formulated with the doctors, our effort now is to make these guidelines available to 2 lakh odd doctors around the country. And we'll make sure, I think they are available, they have access to this latest evidence, and they change their practice according to the latest in diarrhea management. So these are multiple efforts that I think as a company we have taken, and I'm sure our fraternity in the pharmaceutical industry are taking similar efforts to reduce the incidence of diarrhea. And I think support the efforts of other associations, organizations, and the government bodies as well in furthering this objective.
Pharmaceutical industry is working hand in hand with multiple stakeholders and is actively resolving the issue of diarrhea and many other health issues. Next, I would like to ask my questions to the policy makers and understand the state level and national level approach. My next question is to Dr. Baswaraj. Sir, how does the Ministry of Health and Family Welfare intend to mitigate the deaths attributed to diarrheal diseases, particularly among children under age of 5?
As till now we were discussing, this is taken as on a priority from the government side, and set a target of having 0 deaths due to diarrhea in the childhood period. Of course, all throughout the year there will be programs running on in terms of enhancement, promotion of a breastfeeding, early initiation of a breastfeeding, and exclusive breastfeeding, and good practices about the complementary feeding. And as it was highlighted, rotavirus vaccination is also all throughout the year, and community educations and nutritional programs will be running all throughout the year. But however, to give it its due importance, yearly we are celebrating a program called as IDCF, Intensified Diarrhea Control Fortnight. This is generally done, as Dr. Madan Gopal said, in the month of June, where there will be more number of diarrheas in under 5 children. So during this period, it is not just the health department as such. Everybody, the whole government machinery will be engaged in bringing awareness about the diarrhea control, and educating people about the ORS rule and the zinc supplementation rule. And then subsequently, at the same time, even so many activities will be taken up to strengthen the healthcare delivery system also, both in the private and the public healthcare delivery system. So now this is, as we all know, the first person to actually get in the management of the diarrhea is the family itself. For the children, it is the mother or the father, the parents, and the family itself. So the family has to be educated to identify the level of dehydration, and whether the child has dehydration, the child has mild dehydration, the child has severe dehydration. So in order to educate the mothers or the family members, the frontline workers in the department, that is ASHA health workers, who are the accredited health workers in the community itself, and in these 2 weeks, they will reach every house, and preferably where the children are, which family has the children less than 5 years. They educate the mother the signs of diarrhea, and how to detect it, and how to identify the dehydration levels, and what is to be done before reaching the doctor itself. So and along with that, one important thing that we are doing since 2014 is the pre-positioning of the ORS packets. So that every family in whole of India will be having 2 sachets of ORS, so that they can utilize it as soon as the diarrhea starts. And then along with that, during these periods, if the child is having diarrhea, then along with the ORS sachets, they will be given the zinc tablets also. Even after the cessation of a diarrhea, the baby has to be the child has to be continued with the zinc for the 2 weeks. So the more important step that has been taken up here is now everybody is being made aware. And second thing is, when it is needed, they have their ORS at their home, at the domestic home level itself, which has to be started. And more importantly, every family is, or every person is taught how the ORS has to be prepared. This is more important. This is from the Department of Health and Family Welfare that we're doing. Along with that, there are many other activities from the respective department, maybe from the Social Welfare Department or the Women and Child Welfare Department, Education Department, as it was highlighted. Every child is taught the hygiene part of it and the hand washing importance, and so many other activities. So in toto, the whole machinery will be engaged in making awareness about the diarrhea, taking measures to prevent the diarrheas, and setting up the equipping the healthcare delivery system to handle the diarrheas. So that is how the every state across the nation are conducting these fortnights from 2014 onwards, and this is happening in every state during the month of June.
Thank you so much, sir, for highlighting the efforts being taken and in pipeline to address diarrheal deaths in children. My next question is to Dr. Madan. So, having discussed previously about a lot of advocacy and action that's been taken on government's behalf, when can we expect or what steps need to be taken to make National Diarrhea Day a part of the health calendar in India?
As mentioned by Dr. Basavaraj, every year in the month of June, we celebrate this intensive diarrhea control fortnight, IDCF, which is commonly known as. Apart from that, that's a part of the activity so that we prepare for any eventuality due to diarrhea during the coming months. That's one thing. Throughout the year, you are having rotavirus vaccination for the eligible children. That's throughout the year it is happening. That means throughout the year, we have prepared all the institution wherever you go. There are no stockouts of this zinc and ORS tablet, zinc powder, this ORS powders and the zinc solution, zinc tablet. There's no shortage of that. But beside that, we are trying to educate one of the important areas is how to build capacities of your team to manage this diarrhea when the person is reporting at the center or when the health worker comes across a case of diarrhea. That's one thing. Second thing, as rightly mentioned, that means that it's a family which is very responsible for identification of diarrhea, danger signs of diarrhea. So when the peripheral most health workers, what they do during this intensive diarrhea control fortnight, what they do, they go home to home and try to educate the family members also to watch for the danger signs. That means if a mild diarrhea is there, then how it can be managed at home through ORS solution, how to prepare the ORS solution, how to ensure hygiene and sanitation. That is also been taught to the families. And you see that now a lot of awareness is there regarding this hygiene and sanitation, and the episodes of diarrhea is also coming down. Previously, it used to be 3 to 5 episodes of diarrhea based on 15 days recall period. It used to be around 30% prevalence in the 0 to 5 years population. Now it has come down to 1 to 2 episodes of diarrhea over this period, 15 days recall period. That means these efforts are yielding the results. It's not only a calendar is there. It's a fortnight which is preparing, and the states are given flexibility to see whether they want to have it in the first week of June or second week of June, third week of June. Some of the states, if the monsoon is delayed, they usually take it to the month of July also. It's not that key, but nevertheless, everyone has to prepare to tackle to the eventuality which can happen due to diarrhea. That kind of preparedness is there throughout the year. I'll stop here. If anything more is required, then let me know.
Thank you so much, sir, for your insights. As we're close to wrapping up the session, I request Dr. Somnath to kindly give his closing remarks. So kindly unmute yourself.
Yes, yes. Thank you very much, all the panelists for providing their insightful discussion and their thoughts on mitigating diarrhea challenges in India. And it was a wonderful platform, because here we are from pharmaceutical sectors, we are from businesses, we are from UNCs, and government is there. So lots of relevant issues were discussed, and definitely the collaboration can be strengthened from here to develop some challenges plan to mitigate diarrhea challenges. So it's a wonderful platform, and thank you very much, Voice of Healthcare, to designing and developing this concept and these events, so that through this panel, on behalf of Voice of Healthcare and Global Combined Network India, including Dr. Reddy's, I would like to thank each and every eminent speakers for their wonderful uh, presence and insightful thoughts. And thank you very much, everyone.
On behalf of Voice of Healthcare, I once again would like to thank all the panelists for their valuable time and insights. I thank all the viewers for staying online with us during this session. Have an amazing rest of your day.
Thank you.
Thank you.
Thank you.
Thank you, everyone. Thank you.